Hi, this is Avery, and this is my presentation on conflict resolution. And today I'm going to be presenting about strategies for effective communication in nursing. Conflict is an inevitable part of healthcare due to the high-stakes environment, different professional roles, and the need for quick decision-making. Studies show that unmanaged conflict can contribute to workplace burnout and decrease patient safety, according to the University of Tulsa. The learning objectives for this presentation are 1. Define conflict and describe the different types of conflict that occur in healthcare settings. 2. Identify conflict resolution strategies that can be used effectively in nursing practice. And 3. Demonstrate strategies for promoting collaborative problem solving in conflict situations. So the definition of conflict in healthcare is conflict in nursing refers to disagreements or clashes that arise between healthcare professionals, patients, or organizations due to differences in values, goals, or communication styles. These conflicts can be interpersonal, between colleagues, organizational, related to policies and procedures, or patient-related, which is a difference in expectations for care, according to the University of Tulsa. Importance of conflict resolution in nursing. So effective conflict resolution is crucial in healthcare settings because unresolved conflicts can lead to miscommunication, workplace stress, reduced job satisfaction, and negative patient outcomes, according to Program on Negotiation at Harvard Law School. By implementing conflict resolution strategies, nurses can improve teamwork, foster a positive work environment, and enhance patient safety. To illustrate, imagine a scenario where a nurse and a physician disagree on a patient's treatment plan. How might this impact care delivery? Let's watch a short video demonstrating a similar situation and consider how conflict resolution strategies could improve the outcome. Another scenario may be that a nurse and a patient are not getting along very well and are not agreeing on the care being provided. Let's watch a short video explaining a couple scenarios on how to handle situations like these.
Mr. Smith, I have your blood pressure medicine for you.
Thanks. Oop, I'm just dropping. Hey, this isn't what I took yesterday.
Yep, that looks like them.
No, these are really big. I took little red pills.
No, those are them.
These aren't even red. They're blue.
Mr. Smith, the pharmacy would not give them to me if they were not your meds.
I'm not going to take something I haven't already
Mr.
taken.
Smith, just take them.
Honey, take a look at these. Is this what I took yesterday?
It doesn't look like it, but calm down. Let's just, look at the pills again. Can you look at them, please?
I'm telling you, this
I
isn't
go
how
check
I
your
told
book
you.
because he doesn't think they're right. Look, I'm telling you, I have a lot of patients, and I don't have time for this.
Well, I'm concerned about my husband's health, so I think you need to go check.
I'm sorry. I can't deal with this. Mr. Smith, I have your blood pressure medicine for
Thanks.
you.
This isn't what I took yesterday.
Are you sure?
Yeah, these are really big pills. I took little tiny red pills yesterday.
Okay,
These are even blue.
Oh, okay, well, let me go check with the pharmacy and we'll get everything straightened out for you.
Yes,
Okay.
please do.
It's no problem. I'll be right back. How's everybody doing today?
Well, I'm doing okay, but I'm pretty hungry. I haven't gotten any lunch yet.
Well, right now I just don't have the time to check for you. You're just gonna have to, hold off for a while.
Well, are you sure we can't check? Because it's way past lunchtime and I'm starving.
Look, that's not my job. I don't handle that. It's not my problem.
We don't have time to wait. She has hypoglycemia. I think you need to
Well-
make the time to do it, and it is your job to take care of the patient.
Well, they get to it whenever they get to it, They have their job, I have my job. That's not my job.
Okay, well, I don't like the way you're handling things. Go. I'm going to take care of it myself and handle it with your supervisor.
That's fine.
Hi, are you the charge nurse?
Yes, I am.
I'm having a problem with one of your nurses.
You
My
are.
sister hasn't got her lunch yet. She's unprofessional, has an attitude, and just not being very nice.
Okay, I'll handle it myself.
Thank you.
Hello guys. Hi, how are you doing?
Well, I'm a little hungry, but the
You
nurse
are.
really doesn't seem to be very concerned about that.
Why is that, Sarah?
I told her I don't have the time and it's not, it's not in my job description.
I mean, the patient needs something, you go ahead and get it for her.
You know, it's just not part of my job. I have a lot going on. I have to get other meds. I don't have the time.
You know what, guys, just don't listen to her. You know what, I guess you just need to go ahead and get a break.
You know what? That's fine.
You just
I don't
go
want to deal
ahead.
with this anyways.
Just ignore her.
How you doing today?
Hi, doing good. A little hungry though.
It's not my problem. I don't have time to check right now. I'm just here to get your vitals.
Well, you know, it's way past lunch and the lunch tray never came around, so are you sure you can't check?
It's not my job. I told you.
I think that you should go check for her lunch. She really needs it. She has hypoglycemia.
I have all these patients. I really just don't have time to do it. It's not my problem.
I think you need to make time or I'll handle it with your supervisor.
I'm sorry.
Hi. Are you the charge nurse?
Yes, I am.
Hi, I'm Ashley, Tiz's sister.
Uh-huh.
She has hypoglycemia. The nurse hasn't brought her tray yet.
Oh.
You know, being unprofessional, has an attitude, kind of being
Well,
disrespectful.
I'll handle it myself, yes.
Thank you.
You're very welcome. Hello, how you guys doing?
Well, I'm doing okay. I'm a little hungry though, and
You are?
yeah, I was a little concerned about my lunch tray, but our nurse doesn't really seem to be.
Okay, well, Sarah and I will get it for you, okay? Let's go, Sarah.
Okay.
So, what's going on today with you?
Well, you know, I'm just really busy. I don't have time to get it.
If you would like, I'll handle it myself, or just switch rooms if you would like that.
That would be really convenient. Thank
Okay,
you.
we'll do that.
Okay.
Conflicts in nursing can arise in different situations. Team conflicts occur when staff members have differing perspectives or unclear roles, leading to tension. Staff versus patient conflicts often stem from miscommunication or unmet expectations, while organizational conflicts are related to policies and resource distribution. Recognizing the type of conflict is the first step in resolving it effectively. Okay, so the first type of conflict we're going to touch on is team conflict. The causes of team conflict include miscommunication, role confusion, and differing perspectives. The impact of this is decreased morale, impaired teamwork, and lower patient care quality. So team conflicts can disrupt workflow and create stress among healthcare workers. Misunderstandings over responsibilities or treatment plans can lead to insufficiencies. To manage these conflicts, open communication and collaboration are crucial. Encouraging regular team meetings and clear delegation of tasks can help minimize disputes between the team. The second type of conflict is staff versus patient. The causes of this are unmet expectations or dissatisfaction with care, and the solutions are active listening, empathy, and clear communication. So conflicts between healthcare staff and patients or their families often arise when patients feel their concerns are not heard or then when there is a misalignment between expectations and the care provided. These conflicts can be emotionally charged and may impact patient satisfaction. To mitigate these issues, nurses should provide active listening, provide clear explanations, and demonstrate empathy. A simple strategy, such as repeating a patient's concerns back to them, shows understanding and can significantly de-escalate tension. In more complex cases involving patient advocates or mediation process may be necessary to resolve disputes. And then our last type of conflict is organizational conflict. And the causes of this are policy disagreements, resource allocation, and procedural changes. The solutions for this can be transparent communication or leadership intervention. So organizational conflicts can be more complex as they often involve multiple stakeholders, including administrators, department heads, and frontline healthcare workers. These conflicts may arise due to budget constraints, staffing issues, or changes in hospital policies. A lack of transparency in decision-making can fuel frustration among staff. To address this, hospital leadership should encourage open discussions, gather staff input before implementing major changes, and ensure that policies align with both the organizational goals and the employee needs. Including frontline workers in decision-making processes fosters a sense of collaboration and reduces resistance to new policies. Effective conflict resolution strategies help manage disputes while maintaining professional work environment. The 3 key strategies we'll focus on are negotiation, mediation, and collaboration, according to the program on negotiation at Harvard Law. Negotiation is useful when parties are willing to find a middle ground, while mediation involves a neutral third party to help guide discussions. Collaboration is ideal for fostering long-term teamwork. Each of these strategies plays a role in ensuring that conflicts are resolved constructively without escalating further. My first resolution strategy is negotiation. Negotiation involves understanding the needs of both sides and working towards a solution that benefits everybody. Active listening and problem solving are key skills that nurses should develop to negotiate effectively. For example, when 2 nurses disagree over patient care priorities, a structured discussion can help identify a solution that aligns with the best practices. Next is mediation involvement. Mediation is useful when conflicts cannot be resolved directly. A neutral mediator can guide discussions to ensure both parties feel heard and valued. In healthcare, nurse managers or HR personnel often serve as mediators to address disputes between colleagues or departments. The goal is to reach a resolution that supports teamwork and patient care. The last resolution strategy is collaboration methods. Collaboration fosters a culture of mutual respect and shared responsibility. Encouraging open communication, conducting interdisciplinary meetings, and involving staff in decision-making processes can enhance cooperation. In high-stress environments like hospitals, collaborative approaches can help prevent conflicts from escalating. Another thing I wanted to touch on is a positive work environment. A positive workplace culture is crucial for preventing conflict and maintaining staff well-being. Encouraging open discussions, developing emotional intelligence, and providing constructive feedback helps create a supportive environment. Leaders should set an example by promoting transparency and recognizing staff contributions. Providing regular feedback, encouraging teamwork, and ensuring that employees feel heard can significantly reduce workplace stress and improve collaboration. I have prepared a Kahoot for everybody, and I will share the link and have it with this presentation below. I decided we should do a couple of the Kahoot questions that I have prepared. I think there's 5 that I have right here, but there's 15 in the Kahoot, so you are more than welcome to still do the Kahoot after this presentation. But the first question is, what is the best way to handle conflict with a patient? And I will leave some time for you guys to look at the answers. And then the answer for that is the square. Use active listening and clear communication. And the next question is, what is a common cause of staff versus patient conflict? And the answer for this one is the diamond, miscommunication or unmet expectations. Question 3 is, which of the following is an example of team conflict? And the answer for this one is the triangle. A nurse and physician disagree over a treatment plan. Question 4, why is conflict resolution important in nursing? And the answer to that one is also the diamond. It improves teamwork and patient care. And now we're going to move into some scenarios. A nurse and doctor disagree on discharge timing. What is the best next step? And the answer to that is the circle. Discuss patient condition and evidence. A new nurse feels ignored in meetings. What should they do? And the answer to this one is the square. Speak to the manager privately. And the last one we'll do is 2 nurses argue about IV placement. How should they resolve it? And the answer for this one is the triangle. Review hospital policy and discuss. Some critical thinking questions that I want you guys to think about are: 1, how can conflict between healthcare workers affect patient care, and what can be done to prevent this? 2, what challenges might arise when trying to mediate a conflict between two colleagues, and how can you overcome them? 3, describe a time when you managed a conflict in your nursing practice. What strategies did you use, and what was the outcome? And for that last question, that can be in your nursing practice as a tech job, on the clinical floor, or even another personal job that you have. To summarize, conflict resolution is essential for maintaining a functional and efficient healthcare system. By understanding the types of conflicts, applying resolution strategies, and fostering a positive work environment, nurses can improve teamwork and patient outcomes. I encourage each of you to implement these techniques in your practice, communicate openly with your colleagues, and seek mediation when necessary. Conflict is inevitable, but how we handle it determines its impact on our work environment and patient care. These are my references I used, and thank you so much for listening to my presentation.